At age 34, Alicia Bryan discovered a lump. Her diagnosis, stage 3 breast cancer.
My first thought was I'm going to die.
After a lumpectomy and 8 rounds of chemotherapy, she did a genetic test to find out her risk of the cancer coming back.
I do have a family history of breast cancer, but it's not something I was aware of at the time.
Genetic testing looks for a mutation to the BRCA1 or BRCA2 genes, commonly known as BRCA, by a simple saliva or blood test. If detected, it means a significantly greater lifetime risk for developing cancers such as breast, ovarian, or prostate.
I mean, it's not something that most people are aware of.
Alicia carried the BRCA2 gene. She opted for a preventative mastectomy.
I wanted to take a really aggressive step to make sure that cancer didn't recur.
By catching it very early, you're able to change the path of that disease. So you're actually able to literally save lives.
We offer genetic testing because it's information that can empower.
This Toronto hospital has launched a campaign to bring awareness about genetic testing to Black women,
So this is the tube that your saliva goes into.
who researchers say are vastly underrepresented in genetic screening.
We see these genes occurring in all ethnic and racial communities, but what we do realize is that the knowledge about these genes is lower than it should be in the Black community.
Black women with breast cancer face poorer health outcomes. This doctor says genetic screening could improve that.
There's a risk of more aggressive breast cancer that presents at younger ages, like triple-negative breast cancer, and it tends to be harder to treat.
Provincial healthcare plans cover genetic testing for patients with cancer or a known family history. Or for hundreds of dollars, people can self-test through a private company.
Having access to genetic testing is key, or at least knowing that it is available.
It's a tool that Alicia says offered her a path forward to focus on the future. Tashana Reid, CBC News, Toronto.